colleagues at all levels, locally and nationally, the Women's Institute chose to debate and carry a motion to call for more midwives to be employed to address the chronic shortage. We know that we're at our best when we're able to engage others to speak with us as one voice, and this is a very powerful voice. I met a number of the students here today, and whenever I meet them, I have to say to them, I'm so envious of you starting out. I would make the same choice today if I was choosing a profession. But I've really enjoyed meeting student midwives. It's been one of the highlights of my year as president. I've been blown away by the talent, vision and spirit in the next generation coming up to qualify. Entry standards are becoming more and more demanding and competitive, and I know many will need to seek and compete hard for their first job. Students proved to be our most creative and dynamic activists in our campaigning last year, and I think had more hits than just about anything else. You can see the picture here of me with the students from King's College London, and we cycled around London and ended up outside Westminster. And this was a very effective stunt, linking Call the Midwife with the call for more midwives. And we, of course, served cake to MPs who came to see us and local passers-by. We've also seen midwives step forward and take on challenges in our global midwifery twinning project. It's been fascinating to hear from UK midwives who've already been on 2-week assignments in country in Cambodia, Nepal or Uganda, working with the national midwifery associations there. Their contributions and experience is different in each country and at each stage of the project, whether teaching and developing curricula, helping to shape how the association is structured and governed, or working with local midwives in the field. The RCM has been very fortunate in securing this funding from the UK Department for International Development, UK Aid, managed through the Tropical Health Education Trust, FET. It brings considerable benefits, not just to the overseas partners, but to UK midwifery, with the invaluable opportunities for learning, sharing, and personal development open to our volunteers. More than that, participants can bring back new perspectives and attitudes which can transform working culture in the NHS. I'm keen to remind you of what Kathy just told you. The project is now recruiting volunteers for 2014, and if you're interested, talk to my colleagues Alicia and Joy at the drinks afterwards. What strikes me most from what I'm hearing about from our global volunteers is the extraordinary capacity of midwives everywhere in the world to overcome challenge, even faced with the toughest circumstances and minimal resource. Despite the pressures we cope with here in the UK health services, especially the seismic changes our colleagues in England are experiencing, midwives on the whole are striving to provide a safe, caring service and taking forward considerable innovations, and doing so with an undiminished empathy and commitment which makes me very proud to be a midwife. Both in my own continuing professional work and from my activities as your president, I'm learning more and more about midwife-led care and seeing its benefits. I have to say it's been an area of my managerial work and research work for many years, and actually talking to midwives in their place of practice has helped me understand what makes midwife-led care so effective. It enables midwives to live their enthusiasm, their passion, and be innovative. I find it really heartening that our patron, the Princess Royal, is also taking an enthusiastic interest in this model of care. It was a great pleasure to take Her Royal Highness to visit the birth centre at Victoria Hospital, Kirkcaldy last month. I'm pleased to see quite a few colleagues from that unit with us today. I was so proud to show such a strong and positive team. We hope these visits will not only give a morale boost to the staff and women in their care, but also help to promote the value of this model and the wonderful experience of birth which this can enable. And these parents of Princess Royal was meeting were telling such positive stories about the experience of their birth.